This is infection control video 2 with our volunteer Kennedy, and we're going to walk through a room clean.
Okay, so I just came into this room, a patient just came out, and we see that it's dirty. So the first thing that we do is get on our gloves, which, as we saw from the other video, is very important. So we put our gloves on, and first things first, we want to see if there's anything that needs refilling on the cart, because these things are sterile and you want to make sure that you put everything in the baskets and take out the PAP supplies before you touch the bed. So first things first, we have 2 red swabs, 1 CTGC, pop into the basket. Also into the basket goes a speculum. Next we have our PAP supplies, our PAP slide, wood thingy, Q-tip, the Cyto brush, and then we have our little paper towel thing of lube that we put on there with a little squirt. So we do all of those things first because, again, they're sterile and we don't want to touch anything after touching the bed or anything else. So as we can see, there's been some contamination on the counter. So grab everything with your gloves, pop them into the garbage, grab a wipe, quickly wipe down the counter. Anything that you think might have been touched. There we go. So now we take this wipe and toss it. We come over to the bed, and what I find is easiest is to pull down the paper a little bit, rip from the very top, and roll the paper downwards so you're only touching the outside part so that we don't directly touch any bodily fluids that might have been down at the bottom, because of course they will be down on this area. So roll it up, pop it into the garbage. Okay, we grab the pillow, we put it on one of the chairs, we grab a wipe, quickly wipe down the pillow, because again, you never know what's been on there. Put that down, and then we start with the bed. So we wipe from the top first. Every surface. And we wipe the top first because we want to make sure that we get any bodily fluids or any contamination last, so that we're not spreading it around. Very important to get underneath this lip, especially because, of course, female patients will have their, buns right here, so we want to make sure that we get underneath that lip. And onto the pull-out here, all of the sides, all of the little nooks and crannies, the stirrups. And the light. Make sure also that the light hasn't been, that it's not, for lack of a better word, gooey. And especially wipe the handle of the light, because that's what the doctor touches. So yeah, then we toss that wipe, and we wait for the bed to dry. This is a very common technique amongst SDAs, to have it dry. And once everything is dry, we grab our pillow, put it back up, put the paper down, we grab our drape, we take our gloves off properly, pinching, not touching the outside of the gloves, just like that, toss them out, and that's it, room's clean.